The case summary involved in this quality improvement process begins with an 89-year-old female that was admitted to the medical surgical unit diagnosed with COVID-19 pneumonia. The patient had an extensive history of atrial fibrillation, hypertension, coronary artery disease, and advanced Alzheimer's disease. Due to the progression of the pneumonia, the patient is hypoxic, nonverbal, and disoriented. The patient had repeatedly removed her nasogastric tube for feeding and her high-flow Vapotherm. Therefore, she had to be put on bilateral restraints after all other less invasive alternatives were attempted. The nurse intern was experienced in the cohort unit and was familiar with medication administration. However, because of the enhanced isolation precautions, the medication administration checks had to be performed outside of the room with complete barcode scanning and medication checks completed and signed. The physician order included 20 milligrams of furosemide IV push once daily and 40 milligrams of pantoprazole IV push every night at bedtime. The nurse intern drew both medications in separate 3 milliliter syringes. The nurse intern checked the blood pressures of the patient once in the room and realized she had to hold the furosemide due to the low blood pressure of 96/76. This is when both the preceptor and the student intern realized that neither of the syringes were labeled and therefore had to waste both medications. This scenario could have easily resulted in a medication error and led the patient into severe hypotension. In addition, although the medication was held, the correct medication administration of pantoprazole was late due to the delay, therefore resulting in a medication near miss and a useful scenario for quality improvement.